Next is the erect abdomen. This is an image of the erect abdomen. What do you notice? What stands out to you, even if you don't know anything about radiographs? This is an indication of an air fluid level. This is air, and below this point is fluid. So, that's your air fluid level. The erect abdomen allows us to demonstrate an air fluid level. Sir? Hi, my name is Rebecca. I'm going to be getting an image of your abdomen today at my board. Can I have your full name, please?
Benjamin Hamill,
And your date of birth?
1892.
Thank you so much. Please stand with your back against this board. Now, before I position him or do anything else, I'm going to get my tube and detent. So, I'm in transverse detent now. I know that because I see the button next, or the light next to the orange button. So I'm centered to my image receptor. I'm going to angle my tube so that the central ray is directed horizontal. And it's that horizontal beam, remember, that allows us to demonstrate the air fluid level. So the air fluid levels can be demonstrated whether or not the patient is erect or on the table, as long as we have a horizontal beam. Now then, since I'm at the wall bucky, I know I'm going to set my SID, set that detent. I blow right past 72 because for the abdomen, our SID is 40 inches. I know that I'm locked into that 40-inch SID because that light is on next to the green button. This collimation field automatically defaults to 17 by 17. You know that because that light is out to the far corners. You have to go back to the control panel and set that automatic collimation correctly. Now you may come back here and have the screensaver on. Just jiggle your mouse. You have 4 different possible selections on the screen. 10 by 12 crosswise, 10 by 12 lengthwise, 14 by 17 crosswise, and 14 by 17 lengthwise. You just click on 14 by 17 lengthwise. It's also a touch screen. So once you've done that, you're ready to go. And my collimation field is 14 by 17. Next, we're going to place our marker before our patient gets positioned. And it doesn't matter if this light is on or where this wall bucky is positioned. You'll know where to place your marker because just like on the KUB, we're going to place the marker at the inferior outer corner. So we know our light field is going to be 17 inches long, and we know it's going to be 14 inches wide. So we know if we place that marker right here within that 14 by 17 inch dimension, our marker is going to be in the light field. Sure enough it is. But you don't even have to worry about centering at this point. Now, sir, if you would, place your back against this board. Stand with your feet shoulder width apart. Okay, now I'm going to center for the erect abdomen. So I'm going to feel for a place on your hip. Again, we locate that iliac crest. But since we want to demonstrate the air fluid level, we're not worried about including the bladder, so we don't need to see the symphysis pubis, so we can center higher, and we must center higher, because for the erect abdomen, we must include the diaphragms. So I found the iliac crest, and I put 3 fingers above that iliac crest, which for me I know is 2 inches. So I'm gonna raise my tube and center 2 inches above the iliac crest. Make sure I align my central ray to my image receptor. And then, sir, you get arms slightly away from your side. I want to center in at the mid-sagittal plane, which I am. Again, no shielding is necessary. I'm going to give you some breathing instructions. Take in a deep breath. Blow it all the way out. Hold it out. Don't breathe. Exposure. You may breathe and relax. So you notice that one of the differences on the abdomen exam from the chest exam is that we're taking this exposure on expiration. Folks, there's always a why behind what we do. And when you're learning this material, that's how you need to approach it. It's not enough to memorize. Abdomen, take it on expiration, got it. You need to go for the why. So can you think of why expiration? Air needs. So when you exhale, what happens to the diaphragm? I take a big breath, and my lungs expand, my diaphragm actually contracts and lowers.
Lowers, okay.
But when I exhale, that diaphragm raises. So my area of interest is the abdominal guts,
Right.
not the lungs. So I want those lungs out of the way.
Oh, I see.
And I achieve that by exhaling.